The purpose of this presentation is to introduce ICD-10-CM to a target audience of students in the schools of medicine, nursing, and health professions. This presentation only provides a very brief overview, but I will also provide some additional resources for you to learn more about ICD-10-CM. ICD-10-CM stands for International Classification of Diseases, 10th Revision, Clinical Modification. Many people tend to refer to it as ICD-10, but ICD-10 and ICD-10-CM are not identical code sets. ICD-10-CM is a clinical modification of ICD-10. ICD-10-CM is a classification system that will be used for coding diagnoses associated with healthcare utilization in the United States. It is not currently in use. ICD-9-CM, the 9th revision of ICD with clinical modification, is currently in use in the United States. ICD-10-CM will replace ICD-9-CM on October 1st, 2015. This is a major undertaking and has a significant impact on all aspects of healthcare, particularly all entities which submit electronic claims for reimbursement and receive electronic claims for reimbursement. Attention students, do you plan to work in the United States after you graduate? Do you plan to bill for your services, or do you plan to work for an entity which will bill patients for services performed? If so, this change impacts you. The National Centers for Health Statistics is the federal agency responsible for the use of ICD-10 in the United States. NCHS developed and maintains ICD-10-CM. ICD-10 is currently in use in the United States for the collection of mortality statistics, specifically providing a format for reporting causes of death on the death certificate. The clinical modification, ICD-10-CM, will be used for purposes of reporting morbidity in the United States beginning October 1st, 2015. ICD-10-CM files are available free of charge at the NCHS web page. On this page you will find the ICD-10-CM Index to Diseases and Injuries, Neoplasm Table, Table of Drugs and Chemicals, External Cause Index, Tabular List, and Coding Guidelines. These are all components of the ICD-10-CM code set. You can also find the ICD-10-CM files on the Centers for Medicare and Medicaid Services webpage, along with a number of resources to help users prepare for ICD-10-CM. I like to promote the NCHS website as the place to obtain the ICD-10-CM code set because NCHS is the agency which maintains ICD-10-CM. ICD-9-CM and ICD-10-CM were developed by the National Centers for Health Statistics under authorization by the World Health Organization. They are clinical modifications of the World Health Organization's ICD-9 and ICD-10 respectively. The clinically modified versions of ICD provide additional detail and greater specificity to meet the United States needs. ICD-9-CM Volumes 1 and 2 are based on ICD-9, and they contain the list of diagnosis codes and the index to the code set. ICD-9-CM Volume 3 is actually a procedure code set developed by CMS, and it is not based on ICD-9. ICD-9-CM procedure codes are used by hospitals. ICD-9-CM Volume 3 will be replaced by ICD-10-PCS effective with encounters on or after October 1st, 2015. As is the case with ICD-9-CM, ICD-10-CM will be used for a number of purposes, including communication for delivery of healthcare, conducting research, tracking public health, reimbursement, and policy making. As indicated on this slide, reimbursement is not the only purpose of ICD-10-CM or ICD-9-CM. As a matter of fact, when ICD-9-CM replaced its predecessor back in 1979, reimbursement would not have even made the list of the purposes of ICD-9-CM. In some ways, ICD-9-CM is very similar to ICD-10-CM. They are both a tabular list of diseases and other factors influencing health status. The tabular list in ICD-10-CM consists of 21 chapters organized primarily by body system. These chapters are further subdivided into blocks of codes. The blocks of codes are further subdivided into categories. Many categories of codes are further subdivided into subcategories, with each subdivision providing increased specificity to the diseases. This slide shows some of the different characteristics of ICD-9-CM and ICD-10-CM. ICD-9-CM codes begin with numeric characters or with the letter E or V, and they are 3 to 5 characters. ICD-10-CM codes begin with alphabetic characters, and they are 3 to 7 characters. These changes provide a greater number of potential codes to include in the code set. You can spot an ICD-9-CM or an ICD-10-CM code because the codes have a decimal point following the third character. I have provided some examples of ICD-9-CM and ICD-10-CM codes to illustrate the two different code sets and to provide some comparison. Code 599.0 is the code for a urinary tract infection in ICD-9-CM. This code is found in Chapter 10, Diseases of the Genitourinary System. The code for urinary tract infection in ICD-10-CM is N39.0. It is found in Chapter 14, Diseases of the Genitourinary System. Code V03.82 is the ICD-9-CM code you would report for a patient who is in need of a pneumococcus vaccine shot. In ICD-10-CM, the same scenario would be reported with code Z23, Encounter for Immunization. These codes are found by looking up the diagnosis in the index. It should be noted that codes are invalid if they are missing an alphabetic character or applicable character. It is not acceptable to report 599 as a code. It is acceptable to report 599.0. It's not acceptable to report N39 as a code. It is acceptable to report N39.0. Both of those categories are further subdivided. Z23 is a code because if you look it up in the tabular list, you will find that it is not further subdivided. The ICD-10-CM official guidelines for coding and reporting are part of the ICD-10-CM code set. All healthcare settings, physicians, providers, hospitals, insurance companies, they are all required to adhere to the official coding guidelines per HIPAA. One of the most important things to understand is that code assignment must be supported by documentation of the condition in the patient's health record. Why are we making this change from ICD-9-CM to ICD-10-CM? In addition to it being a requirement, it will lead to more accurate reimbursement because of greater specificity in the codes. Claims will be processed more quickly. Data collection for research will be improved, not only within the United States, but also on an international level. Remember, ICD-10-CM is a clinical modification of the ICD-10 code set used around the world. And of course, ICD-9-CM is an antique, and it lacks space for new changes. I have provided on the web page where this presentation is stored a list of selected resources on ICD-10-CM if you are interested in learning more about this code set. CMS, in particular, has created a wealth of resources, and they do a really nice job of educating people about what needs to occur in order to prepare for implementation of ICD-10-CM and ICD-10-PCS. I urge you to go to the CMS website to sign up for their listserv. The link to this web page is also provided on the web page where this presentation is stored. Well, my 10 minutes is up. I hope you have learned a thing or two about ICD-10-CM.